talked about having low risk, medium risk, and high risk counties, or for Dr. Birx. But there's no domestic travel restrictions. What's to prevent somebody from a high-risk county going to a low-risk county? Don't you risk creating a patchwork system, allowing more cases to slip through the cracks and the virus to spread in other areas of the country?
I think this is a very important concept, and it's why we've really worked on messaging to the American people about these 15 days to stop the spread. Because part of this will be the need to have highly responsible behavior between counties. And I think the American people can understand that they will understand where the virus is because we'll have the testing data and where it isn't, and make sure that they're taking appropriate precautions as they move in and out of spaces. I think this will be critical for our future as we work together to really understand where the virus is and where it isn't in real time.
Dr. Birx, can I just follow up on sort of your modeling? Everyone's talking about this Neil Ferguson study out of Imperial and how the modeling's changed. You last week said, or it was on Monday, that you talked about a serology test, something promising coming out of Singapore. Where are we on a serology test? The president said very quickly. And then is that what you need to do, some sort of community survey so you can get to some of these X and Z's so you can figure this all out?
So we're talking to CDC right now. They are extraordinary in outbreaks and contact tracing. So they are going to be the workforce behind any new strategy that looks at counties that need to completely move into containment and surveillance and contact tracing. But part of what they're looking at now is where are these antibody assays. To be clear, there is antibody assays available right now, but they're by ELISA. And what we're trying to do is not just do ELISAs, because they can use that now, but to be able to have point-of-care rapid diagnostics like we have with HIV, where you just get a drop of blood, you put it on a little cassette, and it tells you if you're positive or negative. So that's what companies are working on. Yes, correct. That's the IgG to measure. Now remember, that's not going to be helpful in diagnosis. That's going to be helpful for us to know how many asymptomatic cases there are, or were.
How close are we to figuring out what the asymptomatic rates are? Because that seems to be the big question here.
It is a big question. It is a very big question. And so we have people, the FDA is working on that around the clock. They do have applications that are coming in. We put out a call for applications. I've been talking about it from this podium. If you have an IgG assay, rapid test, not an ELISA. I mean, you could do the ELISA today because the original SARS antigens react very well to the current COVID-19 antibodies that people have, but we're really working on that, both so that we could have therapeutics that could be plasma-derived. So thank you, yes, we're very much focused on that.
How soon will you be able to classify these counties? Because there's a lot of testing that has not been done yet.
Well, you know, there are states, and I just want to really recognize state and local health officials that behind all of this have continued to test and have continued to do surveillance. So we do have states that have been doing surveillance all along, who have been doing contact tracing all along. It never gets reported because it's not, you know, it's not that exciting that they've identified 10 cases. But there are states doing that and have been doing it throughout this entire outbreak, and that's why we have some confidence that that testing has been going on. We have to expand testing for surveillance. But this is that, we talked about a little bit yesterday, the flu platform. So the flu platform is driven off of emergency rooms and hospitals reporting flu-like illness to their state and local governments. And that then will trigger the individuals to get tested. So we have a platform that states and local governments are completely used to. They're not used to doing it this late in the season. They'll do it usually through the end of March, but flu usually tails off a lot by April. So we're asking them to continue the activation of screening for flu-like illness. Now, that doesn't get to his question about where's the asymptomatics and how much of that. That helps us find cases and contact trace on systematic cases.
Different guidance for the places, the counties that don't have the data yet? Will there be different CDC guidelines?
So these are very early days of us trying to, what we're trying to do is to utilize a laser-focused approach rather than a generic horizontal approach. And I think in the 21st century, we should be able to get to that. Why am I confident that we can do that? because we do that in sub-Saharan Africa right now for HIV. That's how we're stopping the epidemic there. So we've done it. We've done it in resource-limited settings. So I do believe we can transpose that approach here to the United States and be able to have, we have granular data down to a GPS coordinate of a site of a clinic and hospital. We think that same thing can be done in the United States.
Dr. Birx, quick question on the would you suggest restrictions to states for something like that? Like if there is a high-risk county and the restaurants are open in a low-risk county, wouldn't your fear be that people in that high-risk county go over to the restaurants?
So these are dialogues that the federal government has to have with state and local governments, because state and local governments make those decisions, and that's what's been inspirational to me, of seeing how much the governors understand where they are in their epidemic and what they will need to do in the future. This is what we're trying to tailor. It requires us to have very clear data disaggregation at the county and state level, but I think you've been hearing from us, these outbreaks and clusters, we've been able to very well define to date. The one that was in King County, the one that is now in New York City, the one in New Orleans, the one in Wayne County. So, and we can see that spread throughout the region and those closely related counties. So this is what we're talking about, how to do surveillance, how to do contact tracing, and how to do each of these items to make sure that you prevent that spread.
What's your timeline, do you think? What's your timeline for implementing guidance like this?
Well, we have to get all of our data together. We owe it to the president. And we owe it to the president to be able to make that decision. So that's what we're working on right now, is getting that granularity.
All right, guys, last question.
I'll go to John for a second. I can speak to that, though. The president sent a letter to all the governors today indicating that, as every American recognizes, that the importance of 15 days to slow the spread, that we're approaching day 15. And what the president told the governors, that we're going to listen to the very best health experts in the world. We're going to examine that data very carefully, and we'll be presenting this weekend the president a range of recommendations and additional guidance for going forward. The president's made it clear that, in his words, he wants to open the country up, but we're going to do that responsibly. And as the president told the governors today, we'll do that based on the data. John, one last one.
Mr. Vice President?
I'll go to John, a little slip away.
Unless there was a last-minute glitch, we should probably see Phase 3 pass the House tomorrow. Yes. Already there are many members who were talking about the need for a Phase 4. Do you see the need for a Phase 4? And if so, what do you think should be addressed in it?
Well, first, let me just say again how grateful the president and I know governors across the country are for the extraordinary bipartisan work that's been done on Capitol Hill. Not just in the bill that will be taken up by the House of Representatives tomorrow, but in legislation last week that extended paid family leave, free coronavirus testing to every American, made sure that all the agencies at every level of the federal government had the resources to meet this moment. It's really been a very inspiring time. But what the president's made clear to our governors, we're going to do whatever it takes. And already we're hearing from some governors about the need for additional resources. And we will evaluate those very carefully. And I think the Secretary of the Treasury has already indicated, and congressional leadership has already indicated a willingness to remain open to that. The American people know we're all in this together. And the unity that you see on Capitol Hill, the unity that this president has marshaled among governors all across this country in our states and territories will continue to drive forward. We're going to make sure the people on the front lines are our healthcare workers, the people that are serving them, make sure our state governments, make sure every agency of the federal government have everything we need to put the health of America first. We'll see you back here tomorrow. Thank you all.
From you, Mr. Vice President?
Who's the wise guy?